So today's topic is continuing in the abdominoplasty or tummy tuck series and talking about how long swelling lasts after abdominoplasty or tummy tuck, which is a very common question I'm often asked. So after, when you think about abdominoplasty or any surgery, you have to think about like the lymphatic channels. What are lymphatic channels? Basically, it's channels that help to drain fluid, drain blood away from your body and help with swelling. So anytime you have surgery, in particular abdominoplasty, tummy tuck, or liposuction, you really are interrupting those channels and kind of disrupting those channels. And so they take time to kind of reconnect. That's why swelling can last a long time, because your body's just kind of recovering from the injury and trying to decide and figure out how to reconnect those channels. So after surgery, typically on the table after surgery, you can kind of tell what the final result's going to be before all the swelling kicks in. All the swelling is going to kick in. All the swelling is probably going to kick in right that next day. So I often tell people, like, that night after surgery, you'll have a really good idea of how everything's going to look. But after that, it's just swelling and swelling. And the swelling really gets a lot worse before it gets better. And so overall, basically after 2 months, about 60% of the swelling is resolved. For example, I saw a lady today who about a month ago had liposuction, abdominoplasty. She also had a breast reduction and augmentation. And she looks awesome. She looks amazing. And what's so interesting and so fun to see is just when I saw her a couple weeks ago, she had a lot of swelling, and you could see it was so much improved, but you could tell that, okay, we have still a long way to go. And when I compare her, when I saw her 2 weeks ago to today, it's completely different. And it's so amazing. And she looks so awesome. And I told her too, and I was like, wow, you look this amazing. And you still have a lot of swelling. So the swelling is going to slowly go away. So basically, after about 2 months, 60% of the swelling is resolved at 2 months. So think about that. 2 months, 8 weeks, 60% of the swelling, which means you still have halfway to go in terms of swelling. So the key with this surgery is just to be really patient with it, because the swelling can take a long time to resolve. And really, it's about 6 months to a year until all of the swelling is completely resolved. It just is something that takes time. So that's kind of sums up the swelling in terms of tummy tuck recovery. I think one of the biggest things is that you just kind of have to be really patient with yourself and with the surgery. Your results are going to start shining through. Your contour is going to start shining through. It's just going to take some time. So again, 2 months, about 60% of the swelling is resolved, and then 6 months to a year is really complete swelling. I notice a big difference in pictures, because I usually take pictures at 6 weeks, 3 months, 6 months, and a year. And when I put those pictures side to side on one patient, I notice a really big change in terms of contour and improvement in swelling. And that's how long it takes for your body just to heal and rebuild those channels to help you drain fluid and things like that. I have a video that I'm going to post to my Facebook, 2 videos. One is going to be on body mass index in terms of how long, not how long, but body mass index in terms of the limits and why they're limits. Body mass index looks at your height versus your weight. So that's one video I'm going to post. Another video that I have that I just need to edit is tummy tuck criteria, which is a very common question. All right. Hope everyone's doing well and staying well, and see y'all soon.